wherever that you are in right now. And thank you very much for joining us. I'm Ahmadreza Abbaslou, the education team leader of InciSioN Global. And here we have our faculty moderators and our dear panelists from different regions and different countries from all over the world to discuss student initiatives regarding COVID-19 pandemics. It is my pleasure to start this session. Just before going through, I would like to mention and review just some housekeeping rules. First of all, this session is being recorded, and this recording will be uploaded later on YouTube on our page. You can search in InciSioN International Student Surgical Network on YouTube and see our previous webinars and sessions and internal capacity building sessions even on our page. And the other thing is this session is live on Facebook, so you and your friends and everyone can watch us on Facebook in addition to this Zoom meeting. And also during the meeting, if you had any question, you can submit your question in the Q&A box. Please do not submit your question in the chat room, please, because that might be missed. So if you had any question, please submit in the Q&A box, and you can chat in the chat room. Just if you want to send a message to all attendees and all panelists, please choose the option of sending message to all panelists and all attendees, because by default the option and the sending settings is set on sending messages only to panelists. Okay, I'm so sorry for talking a lot and having lots of housekeeping rules. Just to save the time, we are going to start the session with introducing our great, incredible, and amazing faculty moderator, Dr. Mamta Swaroop, MD, FACS, FICS, FAIM, who's an associate professor of surgery in the Division of Trauma and Critical Care and the director for the Center for Global Surgery. She serves as a Global Surgery Program Director in the Feinberg School of Medicine at Northwestern University. Dr. Swaroop, it is our pleasure to pass the floor to you.
Thank you guys so very much. It's my honor to serve as a moderator for this session. You guys have allowed me this privilege so many times. But first and foremost, before we move any further, for us to be able to have a discussion and for it really to be an open discussion, okay? I know, although for all of us in this culture, it's difficult for you all to call me by my first name, but the importance of it is something that I cannot express to you enough. So for the remainder of the session, if you can please call me by my first name, which is Mamta, okay? I would be, very, very happy if you did that. And the reason is that when we're having a conversation about initiatives, when we're having a conversation about research, when we're having a conversation about collaboration and what we can achieve together, right? And it's an honest conversation, right? We are all equal. We're all humans at the end of the day, okay? And that hierarchy that's put into place with the terminology doctor, right? Many of you are already doctors. All of you are doctors, right? I'm not the only doctor. You are two doctors. So if you call me doctor, I will refer you as doctor, okay? If that formality is how we are going to do, then I will call you doctor. Simple as that. So it is up to you if we were going to have a formal panel or if we're going to have a panel where we can have a conversation and express to each other our feelings and the work we've done and how things are. So that's why I ask you to call me by my first name. in the hospital, you got to call me Dr. Swaroop. That hierarchy won't go away for a bit, right? But this conversation is us, right? It's just humans having a conversation about what we can achieve together. Okay. So thank you for allowing me to be the one to moderate this conversation. And I can just see Ahmed is just like giggling over there, but I'll turn it back over to him.
Thank you very much. You know that how hard it is for us to call you by your first name, but just to show that we can do that. Thank you very much, Mamta, and I really thank you. Oh, I see that we have a guest here, and thank you very much. Just going to the next part. Welcome, hello to our panelists, and welcome to you all. I'm sorry that because of the shortage of time, I'm not introducing you. Just I would like to ask you all to introduce yourself at the first time that you are called to answer questions. So I think that I was going about Dr. Swaroop. I think Mamta, it is your turn and the floor must be yours. And I'm gonna mute myself and enjoy the rest of the meeting and this amazing discussion. Thank you very much.
So I have, we have some questions as you guys have all, been through this period of time that has, really been something new for everybody. One question that, has, really been on the forefront of other people's minds. And to me, I think that it is, just a matter of how exactly can it be, is how do you all think that students can get involved and actually make a difference in their realities during the COVID-19 pandemic? So I want you guys to think about that, and I definitely want, our attendees to be thinking about that question too, all right? And I'm gonna call upon Nermin, okay? And Nermin, please introduce yourself and, tell us who you are and because you're an amazing human being, but also please tell us about how do you think that students can make a difference in this pandemic?
Thank you, Mamta. I am Nermin Badwi, everyone, a fifth-year medical student from Egypt and the head of InciSioN Egypt. So I think what we all have in common is a desire to help, both as medical students and doctors. And I think what first comes in mind is to educate ourselves so we can educate others. For example, in InciSioN Egypt, we're currently have working to fight misinformation and educate others, mainly med students and interns, on COVID-19. I think it depends on the local situation, the situation of the country, and the circumstances of the student. For example, here in Egypt, we had several crowdfunding campaigns to buy mechanical ventilators and other supplies that needed in the hospital. I'm actually very proud of my classmates who managed to buy 2 ventilators. However, this is a common occurrence here in Egypt among many students and doctors, so it was feasible and somewhat easy to do. At the end, I think everyone should assess their situation, the needs of their country or city, and what they can do to help. That's it for me.
I mean, that's amazing. That's wow. I know there are so many, as distinguished medical students and trainees to consultant physicians who have not been able to garner funds to be able to get ventilators for their patients. So I applaud you. That's so cool. That's so amazing that you guys were able to do that. And I can imagine how difficult and of a situation that can be. And I'd love to talk to you more about that sometime.
It's what we can do. Like, it's what we can do. This is it for us. So
Yeah, that's amazing. I'm sorry, she's being very difficult right now.
okay.
I can't imagine how that must feel to be taking care of those patients, especially with, you know, the difficulties that arise in low resource areas. I mean, even here, there have been so much discussion of who's going to get to ventilator versus who's not going to get to ventilator. I can only imagine the difficulties, you know, there that you all have seen.
I just want to emphasize that it's a common occurrence that every class can join another class community student and aim to buy an equipment from the hospital, and then we gather the money and buy it, which is great.
I really do. I mean, that's I really applaud you. And
I'm proud of my classmates.
I'm proud of your classmates. I would love to be able to lift you guys up higher. That is, you know, what you've been able to do for your patients is, I mean, that's just amazing. It's nothing less than amazing, right? And you should be very proud of your classmates and proud of yourself. I mean, leaders are, you can't take away from what a good leader, right, shows the way to the other people, right? And what your students in your class and others in InciSioN in Egypt have, you know, accomplished are because of your leadership. So
thank you so much, but I can't really take credit for that. I'm really glad that you're acknowledging their action. Thank you.
You're very welcome. Okay, I would love to ask the same question. I am going to say your name incorrectly, and so I need you to correct how I say your name. Jean, you got to help me with your name.
Yes. Okay, thank you very much. My name is Irakoze Bertrand, but if you want to be very good in pronouncing my name, you can say John. John is a French name. Are you hearing me, I think?
Yeah, I can hear you. I want to know how to say it one more time. I'm pretty good with like names, so.
Okay, thank you. Yes, I was talking that my name is Jean Bertrand. It's a French name, but if you want, you can call me John.
No,
John is like John.
I'll call you Jean.
Yeah, thank you. If you want, Irakoze is a Kirundi name. It's very difficult to pronounce, but I think that you can understand what I'm saying. Well, thank you very much for your question. So I just want to answer to this question. So first of all, you know that students are in 3 levels when you're considering them in medical curricula. There are students who are in basic level. We have preclinical student and resident and clinical student. So as you know that the pandemic has deprived the student from their classroom, student must at all costs seek knowledge related to the disease. So here I think that those who have the opportunity, they have to be in contact with sometimes with sick people and they apply this knowledge there. Or other also can play an important role because it is from there that they can give message through medias, clubs, they can participate in association, in NGOs, and many other means of communication here that I can tell to all. Above all, you know that students, they must keep in touch with their sources where they can get sufficient information and knowledge. Here, that include with their tutors, their teachers, medical faculties at all times, and they can get information through information channels available in their countries from the government and from a relevant organization in place. So, and as you can see, students have the possibility to help both the sick and non-sick in families, in communities. They are guarantors of correct application of barrier measures in COVID-19 pandemic period. And in health areas, they can help to provide care, all more so as we know that there's a shortage of human resources in hospital due to a huge number of sick people, and especially in intensive care unit as well. So in short, students can be involved in provision of medical care in cases of COVID-19 because they have the opportunity to find up-to-date knowledge and skills due to the method adopted in most parts of the world that allow them to continue their studies online, as you know that it's case in many countries. Also, students can be involved in the research because they are eyewitness to the reality of the disease in field and understand the disease problem. So students also have the ability to advocate in all directions as they witness all the issues that communities face in process of healthcare, but also in application of barrier measures and their consequences. I think, yes, in short, is this that I can say on the question.
In short, that's amazing. Like that's like in every different, aspect of, like what we talk about, the 4 pillars of academia, right? That's in every single one of the pillars. But you forgot one thing. You didn't introduce yourself. You didn't tell me who you were.
Oh, sorry, I'm sorry. I'm a medical doctor. Yes, I'm recently graduated from the University of Burundi in last April. What I have to specify is that I'm a member and co-founder of InciSioN Burundi. Also, I'm participating just now in a local medical students association. Also, I'm a subteam member, educational team member in InciSioN Burundi. Thank you very much.
So tell me, in these different ways that students can participate, how has InciSioN Burundi participated, and how have you taken all of these different ways? Because it's almost, it's the ways that you all, have been able to do things is just unbelievable. So, how has your take been on doing things?
Yeah, here in Burundi, I think that, as you know, students have struggled to participate in many activities in this period. Sometimes there is the climate that doesn't allow. Here I mean the climate, not the sky, not the climate as we hear. It's a climate in all senses, including political, including system of education, including all. But in InciSioN Burundi, I can specify that we've organized many activities online to make population know the barrier measures, to make the population know what they can do in this pandemic period. As you know that the lockdown have not been here in my country. We were preparing elections, many other activities that have been held in my country. So, but the barrier measures and other information related to the pandemic in order to stop the spreading of this disease have been allocated in many social medias, also in clubs, and sometimes in exchange on phone texting and other means of communication. Thank you very much.
Oh, sorry, I was muted. I said that's great. That's really, really, that's awesome. And how you guys have kind of come together to do that and bringing those educational initiatives together. So, you know, we'll go on to the second question, but I think it kind of nicely leads into that second question. You know, as we've talked about how students can get involved, okay, you know, there's been much discussion, you know, since what has occurred, at least in the US, and that has like just shown so much of what occurs globally, right? And I think that sometimes what happens in the US is interesting because the US doesn't think that it can touch the US. Do you know what I mean? When there's terrorism that happens in the US, it's like, oh my God, right? And it's like, well, you know, this stuff happens all the time in other countries. Similarly, when we have things that happen such as racism, right? We're like, okay, but that happens all, you know, in many countries, there's genocide that happens and all sorts of things. I think that what was so powerful about the George Floyd video, right, is the fact that we watched him lose his life on camera, right? And I think that that is what hurt people all over the world, right? So this leads me to the second question. So minority health, defined as the healthcare of varied minority groups. So for example, refugees, indigenous population, you know, lesbian, gay, bisexual, trans, queer,
I think we lost her connection. So we can wait for a few seconds.
Guess we've lost his connection.
Yeah, let me send a text to her.
Today seems to be a day for technical difficulties. A lot of people are having issues.
Exactly. I think she lost internet connection at all because my message in WhatsApp has not, you know, received to her. Delivered, I'm sorry. I apologize to our dear attendees. These technical issues are unexpected, and we are really sorry for this unexpected issues. Honestly, today is today is really interesting for us because I think at least half of us have had connection issues, including me, myself. I couldn't log in with my laptop, and I'm here with my phone.
Including us.
So just until we have Mamta again, if I'm not wrong, she was asking the second question, and I'm gonna ask a question, and let's continue our discussion. So we will have her and pass the floor to her again. So the question is, Minorities' health is defined as the healthcare of varied minority groups, such as refugees, indigenous, LGBTQI, and other communities like homeless people, black people, various disabled groups, and so on. These groups are worst affected by a large number of diseases because of because of the vulnerabilities they encounter. In this context, how can students be involved in providing healthcare to this population during the pandemic? Jean, I would like to call you to go first on this question.
Thank you very much. I think we're going to attack this question in several sides because racism and not racism as Mamta was talking about. Minorities, they are people who are mostly affected by the COVID-19 pandemic for several reasons. Firstly, they have a precarious living conditions on hygienic and economic side. They often live in very poorly equipped agglomeration and overcrowded places. As you know, they are prone to various and sometimes serious diseases, including chronic non-communicable diseases, as you know, and the virus is particularly contagious in these places. So this has been demonstrated by concrete facts, as it has been noticed in some countries. Here I can tell the United States, as Mamta was saying. For example, in France, I hear that the mortality rate in non-French descent has increased by 45% during the period of the pandemic. So what I'm going to say is that it is undoubtedly in this group that we see highest transmission rate in all countries. So this in addition to the controversies in perception of understanding of the disease fueled by a certain political opinion and interest. So this creates an unprecedented rumors in minority communities. So this is a major obstacle to the delivery of necessary aid in all its forms to these groups of people. That barrier measures are highly despised and social distancing cannot be advocated in this group of persons. They cannot wear masks, and most of them cannot even afford to buy the masks in those regions. Also, in here we can also add gender-based violence and many other situations that contribute to the spread of the virus. And that this is common in those minority groups. So for me, I think that medical students find the important place, their fair place in this community, but because that they have the family ties with some of them. They recognize them as intelligent and often believe in them. So they know that the student cannot lie a member of his family, his neighbor, his friends, his brother, his sister, or his cousin, as you know. So the duty of the student is to be exemplary in this community. So they can bring verified information to these groups of people. And I think that the message will be welcomed. So students also can be educator of this population by raising awareness about the use of how they can wear masks, how they can practice the social distancing, screening also the means of contamination of the disease and some means of protection, and the risk of not applying those measures. So I'm sure and certain that people will be able to listen and apply them in full. So, but the fact that consent is needed with these groups of people before launching any types of activities, these ones must be preceded by the pre-field preparation campaigns. And here I'm convinced that medical students are the best suited to do it when they are supported by competent authorities and faculties and schools of medicine. So students have to be guardian of SDG like let no one behind, as you know, the safe and equal access to healthcare for all and equity in all. And by this, all the advocates' parts find in a real place enough of applicability to address all inequalities in healthcare deriving minorities, which is rare everywhere around the world. Thank you very much. It was my view to this question.
So I have a question for you. So you said that it's not possible for this population to potentially even wear masks, right?
Sorry?
To wear masks, that it's not
Yeah.
possible for them to wear masks, right? My question to you is, in the sense of like where you said that for students to be able to accomplish certain goals, right? They needed to be empowered, right? Okay, so something I want you to think about, because we're going to come back to it, I'm writing it down, okay, is that how do you think, so this is like totally off topic, right? How do you think that students, okay, can empower the community? Okay, don't answer it right now. This is something I want you to think about, all right? How do you think that, you know, the homeless population or populations that are unable to, or that are fearing of the government or fearing of authority, okay? And I'll give you an example of it too. So I'm gonna ask you, because I always ask these questions of students, right? It's like, you come and bring me a problem, but for me, it's you thinking through and trying to tell me a solution, and then I'll help facilitate that answer. And I see that someone's chatting. Social accountability is the answer, dear Mamta. So Lucas, tell me what you mean by social accountability, and I promise we'll talk about that in a little bit. But I want to hear also from Pavranaj. And Pavranaj, can you just you know, give a little bit about, introduce yourself, and then tell us about the answer to this.
Hey, thank you, Mamta, and yeah, glad to have you back. So I'm so thankful, first of all, to be here and honored to be considered among this panel and in Mamta's presence. So I would just want to try my best to air my views, but also learn. I'm definitely not an expert, but hope to incorporate what I've experienced and try to be involved in. So my full name is Pavranaj Singh Chana. Pavan or Chana is an easier name. And I'm a finalist medical student studying in Moi University, Eldoret, which is a small city in a small town in Kenya. But I'm currently home in Nairobi, which is around 315 kilometers away from my university. And I've been home for almost 4 months now. So I'm a finalist medical student, but also part of the InciSioN IT international team and part of the Kenyan National Working Group, which is a student surgical forum, and actually chair at my university. So apart from that, I'm also a committee member of the research and design COVID-19 response we have here with medical students, also part of the National Research Coordination of Standing Committee of Research Exchange. Also now we've gotten a team of One Health response to other zoonotic disease teams, so part of that. And also a board member of the International Cancer Institute. I'm also a cancer survivor. I was afraid of saying this, but I just decided to consciously accept it and also explain it. So coming to the question, I'll just go right into it. Mine's more of a reiteration of Jean. So I will first start by saying that healthcare delivery should have never been relative to any socially labeled denomination or even contextual circumstance. It should have always just been equal, but I know that's not reality, which is so sad, but most of us are trying to reduce and hopefully eliminate that and eliminate such disparities. So as John said, like these vulnerable populations are at greater risk since they're exposed to different hazards. And this depends on the financial hardships, the cultural facets, language difficulties, discrimination, and even emerging sub-themes that we have right now. Their health needs are so complex, their social and economic paradigms that you have to consider. And I will try to answer this question in terms of health domains. And those are just three. So they have like physical difficulties being the first one. Some of them have, physical difficulties, which include some of them having chronic illnesses and disabilities as one of the vulnerable groups. Psychological domains such as like post-traumatic stress syndromes with different events, depression, and this can be worsened with substance abuse, which either is used as a compensatory mechanism or they're just exposed to it and because of poor health reach. And then in the social realm, there's stigma, violence, and some are actually in abusive families. Then there's the law enforcers as the case of George Floyd. And then there's also other aspects. So these are just compounded by now that buildup of mistrust, hopelessness, and fear that they've grown to have. And that interferes with any health intervention. So when it comes to student initiatives, we should consider all of these, and there are also personal and group or population initiatives. There are also some we can just do in our neighborhood and in our communities. So students should just generally give guidance to the communities and like helping guidance to the correct facilities, who to see, help them with protective personal equipment, which they don't, some have, or some people actually have this bias that they don't want them to have it even. That's an emergent issue. And then we should just educate them all about transmission, necessary precautions, not only for COVID, but for other illnesses that they're exposed to depending on where they are. And spread the word of services, like even with some of the vulnerable populations exposed to violence and rape. So there are services that we as medical students know about in our hospitals that we can refer them to and tell them about. And primarily, I think students should take the personal initiative of learning as much as they can, familiarizing themselves, because knowledge is power, and this is always helpful by reading widely. So for more targeted insight, I would say like for homeless people, in my experience, like we have this group in Eldoret, which is called the Tumaini Innovation Centers for Street Youth. So we try to reintegrate street youth back to the homes or the house so that they're not exposed on the streets. And we try to provide for them PPEs and sanitation centers. Also try to help them with education and any telemedicine, telemedicine facilities. So we're trying to, and that center also helps them with skills they can learn right now. So they're trying to get empowered so that once they go out, they're able to like stand for themselves. So these initiatives, I just wanted to, like, as I address some of them, I wanted to say that there's some temporary, like if you correct the homelessness, then it's done, but there's some which are long-term. So the ones like for the long terms are like those people with disabilities and chronic illnesses. Students should and can disseminate, like, Braille and multiple forms of communication for different disabilities. They can help in their neighborhood. They can help the carers take care of them. They can help by shopping for prescriptions. They can guide them on why some comorbidities are more dangerous. Then they can also help them get followed up so that they don't, even remotely connecting with their lecturers, their doctors, just help that way. For refugees, they can support them with translation if they're from a different country with a different language. With this health information, advocate for inclusion into public health services so that they get equal opportunities in either private or public facilities. And then they can also help them monitor. Like in Kenya, we have Kakuma refugee camp, and I'm constantly in touch with the people there. And they usually say that they have livelihood challenges, especially with financial setbacks. So they're not being included as one of the risk groups. And then with the LGBTQ group, we can try to engage them. We can also connect them with networks. We can also keep them protected. I mean, in many countries, including Kenya, which is still sad, there's still a lot of stigma towards them, and still not, it's still illegal, but we can have a forum, and like in our as medical students, like I've experienced, we actually have a forum for that. And then we're not forgetting that people are at home sometimes. They're exposed to gender-based violence, so we can always update the referral ways for them to get help. Ensure that there's safeguarding, that people comply with these and the likes. And then we should just educate other people about contraceptives, to avoid just unnecessary predicaments like unwanted pregnancies, STIs. And then finally, as I wind up, I'll just say that we should always just be open, available, check up on each other, counsel each other. I mean, we're all dealing with stresses, anxiety, and this is crucial for our mental health. We cannot also be sound, and we cannot help other people if we're not sound ourselves. Yeah, so thank you.
So I think that that's great. Thank you, Pavan. So you said something about knowledge is power. So I'm gonna challenge you on that question. So
Okay.
if I read all of the surgical textbooks, or Tina reads all of the surgical textbooks that there are out there, can she become a surgeon just by reading all of those?
Okay, they can have a good idea, but they also have to practice it and also gain sort of practical approaches with the situation they're found. They could get a good idea though.
Okay, so if I read everything that there is in regards to what a refugee population and a Black population or a minority population's needs are, okay, I read all about them, okay, that knowledge. Does that knowledge make me powerful without any action put behind it?
No, it doesn't. But you can like formulate a way to address it somehow.
Right. So that addressing it is action. Okay. So
Yes.
knowledge, right, without action is not
Useless.
power. Yeah. It's not
Yes.
useless, right? You can have many conversations to empower people, okay, potentially, right? But if you have knowledge and you make action, right, then you have power. Okay. Again, it goes back to when I was, what I was saying to Nermin, right? Is when you have that leadership of where you're actually making and you're doing, right? Then people do behind you. Right? So there's many flawed people in this world, and I think these days that everybody criticizes people in general. You know, are people who we have thought of as what are they called, role models, right? Everybody criticizes them. No one in this world is perfect. You can take any specific role model in the world, right? But somebody who I've respected in the past, right, has always said to me, and yeah, you're right, knowledge does come with experience, right? But that experience, you screw up everything first, right? And you learn with that experience. Yeah.
Yes.
Yeah. So I think that, you know, two things what you guys were both saying that stimulated something in my head is these different populations that we have, right? Again, we're all human, right? And the thing that, you know, we see in all of these different countries, right, is all of us, every single person on this thing, on this panel, just on the panelist here, I can tell you, if I came to you and said to you, you have bias, what would you say to me? You treat some patients differently than you treat others. Would that be true or false?
True.
Okay.
It'd be true, yeah.
How about you, David? What do you think? Would it be true or false?
Definitely true.
Okay. Makina?
I would have to agree with you, because even if we don't consciously mean to treat patients differently, unconscious biases are known as to be unconscious for a reason. The environment you grow up with, the people that you're surrounded by, those are critical when you're growing up to form your beliefs and your perception of the world. So when you're dealing with such a diverse patient population, when you come across people that you don't have that experience with, you're going to rely on biases as well as stereotypes in how to interact with that person. So I would say that regardless, you will have unconscious biases. So I think what we need to be able to do is first of all to admit that to ourselves, but to also have the skill set and as well as the appreciation to actively work against those unconscious biases to ensure we get as close as we possibly can to treating all patients equally.
How about you, Jean? Yes? No? Jean-Renat? Do you guys agree? I mean, do you guys are you can nod your head if you guys are in agreement, right? So you all are actually probably the strongest group of you. I'm in tears. I don't know if you can see it, but I am. I'm in tears because do you know how difficult it is for physicians to say that they have bias? It's one of the hardest things in the entire world for people to say. Okay, so I'm very proud of you guys to say that. Okay, and you know, I think that question in and of itself, right, is pretty powerful. So when you know your bias, then you can work towards other things, right, and moving forward. And I know I'm going to put this quote up and you guys are going to be like, oh, he wasn't that great, you know, and some will say, oh, no, Cake, he was that great. But I live and die by this, right? And the hashtag is be the change, right? But for me, it's not just that simple, right? If we could change something in ourselves, right, then as we change ourselves, other people will change eventually as well. Now, Gandhi was not like a perfect human, right? He had his issues of racism as well when he was in South Africa, okay? So I'm saying this with a grain of salt, okay? Anyway, so let's continue to go on to our next question. Because this is a whole nother webinar in and of itself, and I think Kathy and Ahmadreza are going to kill me for diverging on to a different topic. What can society do, you think, to encourage and support these meaningful youth engagements in public health and emergency of international concern? And how do you guys think we can ensure that the opinions that you guys have are actually heard and then taken into consideration in policy formation? Okay, so I mean, it's fairly pertinent to what we were just talking about. The fact that you guys are able to admit these things, right? It's a big deal. All right, David, you're up. And just please introduce yourself.
Hello. Yes, I'm David Myaipaya. I'm currently the chairperson of InciSioN Tanzania. But also, I'm just done with medical school, so I work at the hospital as an intern doctor. I usually have a 1-year period of internship. So before that, as medical student, I've been engaged in leadership, and I was also privileged to be the national president of Tanzania Medical Students Association, which currently I'm a member of the supervising council. Yes. So ideally, the youths and maybe the adolescents are key people to be engaged in pandemic, and right now, as we are talking about COVID-19. So the youths have a large role to play because in our country, the youths take the largest number of the population, but also they are the people that are more active and more engaged in most of the work that there is. But also it's the part of the group which is largely in school. So some of the things I'll say the things which I've seen being done here in Tanzania, which a way in which I see the society has done, or so that us as youths can participate in dealing with this pandemic, but also so that our views can be heard. So like the Medical Association of Tanzania, it has been working closely with the Medical Students Association. So in organizing activities, like maybe when they organize an activity, also the students are given an opportunity to participate in there. So like we had an activity where people had to be trained volunteers so that they can go to health facilities which are at remote areas so that they can go and teach them or give them guidelines, ABCs, on relating to precautions and management of COVID-19. So the updates of what has been happening. Usually those remote areas, they are limited. So what they did is they took some students, that means from the Medical Students Association, so because the universities were closed then and they were trained and they went there with some physicians. So they were doing and being supervised, which was one thing which I think can be done so that students can participate and also youths can participate in this engagement. But also the society can help by supporting adolescents or adolescents and youths to lead interventions which can be online or offline, which as long as they are safe, so that those things that's a way that youths can influence their fellow youths in addressing this agenda. But also together with that, if people are at home, youths can also be encouraged to help their younger youth, like maybe university student. I have my little brothers and maybe my neighbors that are also young, but they're also in school. They can also be taught. That means I can share with them knowledge on what I've been learning. But also another way on the part of the policy, which I think is quite of a challenge, is it's not really that easy to put them in a very specific role in the policy aspect, but it can be. But I see the easiest way that we can begin by is those organizations which are involved in policy making to recognize youth-led organizations, maybe like medical students associations, or maybe if it's different youth groups which are there, and they call them in as they are making the policies so that they can also have their views during the process. I think that can really boost the knowledge, but also create a room where the youths can have a say, or at least they can hear their views, even if maybe directly or indirectly. So those are just a few ways that I think we can begin by where the society can pull the youths closer and to have them engaged.
Absolutely, I think that's fantastic. I would love to hear about David, like how that's occurred, in Tanzania, like a little bit more, and how you've been able to do that. And that would be really great to share with other countries, not just in the continent, but throughout, because I think that would be a really neat way of, building up something that all of InciSioN can do. So I love that. It's great. Nermin, would you like to give your perspective on this a little bit?
Thank you. Our valuable asset in the fight against COVID-19. I think we need to empower and educate medical students and young doctors so we can fight the misinformation. They can also join and participate in research projects, for example, like COVID Search and the newly established children NCDs. They can, by joining the research, they can help us know better and understand COVID-19. Regarding the policy and use, I think regarding policy and use, I think it's a common problem we all share as a student. There is a disconnect between policymakers and students usually, and I think it's probably due to generational gap and lack of communication. We can't really get invited to the table if they don't know that we exist. And I think youth organization and student association help us bypass that obstacles. I know for certain that IFMC Egypt, for example, are successful in such endeavors. So I think just youth should stand together and agree on a certain goal and then approach the authorities or the policymakers. That's about it for me. Sorry, I can't hear you.
Oh, can you hear me now?
Yeah.
Okay. Have you all been able to make changes or been able to allow for changes to occur? And I mean, you guys are doing such amazing things. Like, is there something that you know, I think it would be really great if you and David were able to speak to one another, and you know, if Pavan and Pavranaj could also, like, you know, talk a little bit about, like, if you guys have been able to come together and figure out like what things have worked in your countries to see how additional changes could occur in your countries. I think that would be a really, really neat conversation. Perhaps not live recorded, you know, here, but I think that a private conversation would be really, really good thing for everybody who's on this webinar.
That's a great idea.
Yeah, I think that would be really powerful, I think, to be able to share those lessons learned. And I think that also, you know, we talk about breaking down silos, right? And I think those silos are not just, you know, anesthesiologists, surgeons, obstetricians, internists, blah, blah, blah. I think those are just even in our countries, right? You guys are national working group leaders, right? So, I mean, Kathy, you know, we need to like have, you know, these guys at least, you know, regionally be able to meet and talk about whether it's policy or education, things that have worked in, you know, their continent or their area, so that they can kind of like amplify what they're doing. And, you know, we've got some amazing, you know, humans who are, you know, I mean, I'm always here. You guys know I'm always here. And, you know, these Makina, Ahmadreza, and Kathy all have my WhatsApp, and you guys are more than welcome to it. And you can always text me. We can make a group. But, you know, it would be a really good thing for you guys to have someone who, you know, is in your time zone, right? Because it'll be like a little delayed always, right? But, you know, to be able to, who knows the area as well. I don't do any work in Africa at all, right? But it would be really great to be able to have someone who knows more about the region and everything. And I have like a few people who I truly trust, who I would connect you guys with, so that they can guide you a little bit to make these changes. Because I think that man, Bob, and I love that. I'm so glad you said that knowledge is power, because I swear to you, I swear on everything that I own. I teach a course and I say, it's great to know how to put somebody in the recovery position or to tie a tourniquet, right? But knowing it is one thing. Breaking that barrier when you see someone hurt, right? And doing it, it's a totally different thing. So for example, in India, right? All right, when we go to India, right, my mom would like yell at me in the times before. Don't get involved in the accident, otherwise police will take you too. And I'm like, I don't care, right? Like that oath, that thing that's inside of you makes you want to stop. So you stop, you make sure that the person is okay, and then you keep going, right? Or you make sure that the person gets to the hospital. Man, she's been so mad at me so many times, I can't even tell you. God rest her soul. Okay, so we've talked about policy, we've talked about initiatives. Now, when we're talking about, oh,
sorry, you called on my name, and then I just wanted to just quickly mention something quickly. So with regards to how we communicate overall, we have a national working group chat. We are all on that chat and we talk to each other all the time. It's one of the best parts of every day when you get to see the chat light up and hear everyone's amazing ideas. In terms of regional collaborations and specific to COVID and the challenges that we've all been involved in, I think this pandemic has forced us really to step out of our comfort zones. We have the routine campaigns that we do and everything, and those are fantastic, but this pandemic made us have to take lead in a different way in our communities because there was no one else. We had to do it. And we saw the needs, in a different way because our professors, our faculty, our residents, people who usually taught us were busy taking care of patients, putting their lives on the line, trying to do that. And we were pushed out and we couldn't sit still and we had to do something, right? So the call to action that we launched on Global Surgery Day, we unfortunately had to be a little bit sort of scaling back on it over the last month because we wanted to be respectful of everything else that was happening around the world. The anti-racism, the movement against structural racism, that's how I think we should call it, is something that's necessary, that we supported and it should happen. And we wanted to be not only supportive of that, but also respectful of it and allow room for all those conversations to grow. And we haven't forgotten about our call to action. The plan for the call to action is exactly just what you said, Mamta. For us, you've been so kind to introduce us to so many of the amazing faculty and professionals. It's not just faculty. I know there's so many of them that are not teaching, but they're professionals in the global surgery world, whether they're advocacy experts, they're education experts, they're policy experts. And the plan is actually, you're making me let the cat out of the bag now. The plan is for us to launch sort of conversation groups to build capacity regionally based on people's interests. So let's say, for example, I'm just going to call and say, Nermin here has an interest in learning more about how to impact policy in her country, and David does too. So the two of them will join that group, and we'll have these amazing individual, professionals and faculty come and have a very informal, not a formal webinar, not a formal meeting, just a conversation where they can share their experiences and expertise and sort of empower students and trainees to go and then have an impact and effect within their own communities and their own regions. And I am willing to bet that there will be regional collaborations that are going to be born out of this. But we're going to let it all naturally happen because it does. In InciSioN, we still have, despite being 50 national working groups now, and despite being 5,000 members large, we're still very passion driven. I love the fact that in the morning I wake up and there is a message from 2 a.m. from a national working group, and I see already 3 other national working groups have joined up on that project, and they're moving it along before anyone can even, sit down and write it on a paper. That's the beauty of InciSioN, and hopefully we can harness that and make an impactful change. This morning I was on another call
on another sort of a webinar where WHO, there was a high-level meeting on UHC and talking about COVID-19 and investment in COVID-19 relief. Incredible meeting, very informative. Again, no one talked about surgery. No one talked about surgical systems. We got to do it. It's on us, and we'll do it. Sorry, I didn't mean to go on a tangent, but since you called me out on this, I had to just answer that.
I mean, I know you had been planning this, so I thought it was a pretty good plug for you to be able to say this, because it's necessary. And, you know, I think it's really, again, we were talking about, you know, empowerment, right? And when we are talking about empowering the community, right, we talk about empowering grassroots organizations, right? And that is one way of empowering the community, which we'll get back to, Pavranaj. Don't worry, I wrote it down. Or you know, who was it? Jean Bernard, right? So don't worry. So we'll get back to that. So quick question, Ahmadreza, how are we doing on time?
I think we have 2 minutes. So just to check the Q&A box, we have 1 question submitted until now, but I think we've had, you know, several discussions in the chat box, chat room. So, you know, paying attention and, you know, discussing on those discussions in the chat room is up to you.
Do you want to tell us what the question is so that we can make sure we answer that question?
Sure. The question is, how can students or trainees get involved to fight the pandemic in countries where the authorities refuse to take seriously COVID-19?
Yes, thank you. I think the question has been addressed to me by Pacific Irakoze.
Yeah.
Thank you. So, to this question, I think what I have been talking to you before is this: when authorities refuse to recognize the pandemic or to associate students and trainees, here you understand it's very difficult for students to work freely or to provide what they want to the population. But here we still with the possibility, because I mentioned before, students, they have the best opportunity to be accepted by the community. This is an important thing that we have. They know that we can't lie to them because they trust us, because we live in society, we live with them and we dwell with them at all time. You cannot lie to your mother, to your cousin, to your brother, to your sister, just to the community. But the politics can lie, as you know. This is a reality. This is a real thing. They can lie for their proper interests. So what we know about the disease, what we know scientifically, we can distribute this to the population. We can tell the truth to the population and they will trust us. This is what we have been doing here in countries. This is what have been doing in other countries. I have heard this in Brazil when they have till now the health minister. This is a strategy that trainees and students can use. We know the best information. We have realities on the ground. We are at all time receiving patients, and we suspect COVID pandemic infection, and we are not allowed to not to treat patients. We have to provide the care to the patient. So this reality that we are facing, we must inform the population as we can. So we need not the consent of the government to say what we know about or what we have learned, what we are sure of, what we know. So we have to provide what we know that it's real. what we observe, what we see, what we are facing day to day. So I think that this is the best mean, because medicine have no limits, if you want, and sometimes politics doesn't understand what medicine means. I'm not trying to minimize the political issues in countries, but you know, the politics is politics, but medicine is a real science. We must tell the truth. I think that is my point of view of this. Thank you.
I think you're absolutely right. I mean, look at our country. I mean, you know, it doesn't matter if you're a high-income country, a low-income country. I mean, do you know what I mean? My father lives in Texas, and he lives in a county that literally there was an emergency text message that was sent out saying, do not leave your house if you don't have to, okay? Do not, if you leave your house, wear a mask, right? And you can't cross county lines, right? My father's 80 years old, and I can't even go to get him out of there at this point. I can't drive to Texas to get my father out of the city of Houston. You know, it is absolutely crazy to me when individuals are not taking this seriously. But even more than doctors, right? I think students are much more powerful. And I think you guys are so powerful because of exactly what you said. You're learning, right? So there's no benefit, right? There's no ulterior motive that you all have, right? To do things for your patients. There are 100 different, you know, reasons that people may want doctors, researchers, consultants, right? Whether it's for private or if it's for research stuff or for a paper or this and that, right? That consultants may want things, right? But when it comes to students, medical students, you know, you guys are like pure. That's why we always want things for you guys to hold them, right? Everybody is much more comfortable when the students have that power because it doesn't exist. There's a pureness to it. And even when, you know, that changes over to a, you know, higher level, right? Sometimes you can start to see, you know, someone having, you know, a desire, a power hunger. And when you start to see that, you see that change in them. And it's a really weird thing. But I mean, I think you guys are, you know, you guys inspire me every time I am able to talk to you. So now just to go back, anybody else have anything to say about that, about students? Kathy, Ahmed?
No.
No? Okay.
No.
So, you know, from the very first, session that we did here, okay, I remember talking to a bunch of you guys about, you know, what we were able to do, right? And because I'm a trauma surgeon, they took my trauma and acute care, they took my ability to do acute care surgery away. So we were only doing trauma surgery and then intensive care, so that, you know, we were not, if we needed to have critical care doctors, we were able to. And so I remember, you know, there were some students who said that they couldn't go to the hospital, right? And they couldn't volunteer their time because of, you know, they may have had, you know, a member in their family who was ill, right? So one of the questions that we have is, you know, what do you think that students who can't go back into the clinical environment, you know, what can they do, right? And I you know, this is supposed to be specific to, you know, two specific panelists, but if you can all just tell me in one word, right? How do you think in less than 30 seconds, and I know that's going to be hard for some of you, but less than 30 seconds, can you tell me how someone can contribute if they can't do actual practice? Ready? We'll start with Oven.
So, wow, 30 seconds. So I think it's actually a very interesting time. This is actually like a very demanding situation that allows for extraordinary expression and action, as you mentioned. And it's also a historical opportunity for medical students to claim that responsibility of demonstrating that they're active, relevant, and are standing in solidarity. So they can actually, I know I've passed 30 seconds, but I think they can actually like come up with ways that do not only target the current situation, but also make sure that the current problems right now are not carried forward. And then also not oversee things. I mean, no one expected this, but if students can start preparing around such possible problems like we're facing right now, then they can be the future. They can be the future policymakers, and they can actually, yeah, they can actually be the ones who take that action that time.
Way over 30 seconds.
Way over.
Way over 30 seconds. You did the super desi thing of going way over 30 seconds.
I know.
30 seconds, man. All right. Okay. Jean-Bernard, 30 seconds for real. Okay. What is something that students who can't go back to clinicals do?
Sorry, you say?
Students who cannot be in clinical practice, how can they contribute, okay, to the current situation, the COVID situation?
For students in clinical climate, I think that their contribution is real because, but I'm sorry to respond to this question will be very difficult for me, but what I can say is that in many non-developed countries, students are not very, very associated with clinical research or patient care. They're sometimes considered as students, as you hear. But students can be in clinical area. They can be associated with research in COVID management, as you know. For example, at the protocol who have been proposed by the WHO, which aims to promote detection, identification, the prevention, and the reduction of transmission, I think for students, what is very important is to be associated with the detection and the identification of patients who have been infected by the virus. So it's true that most of clinical signs of COVID are already known, but students should have better to depend them. But for my view of research, students can be associated with patient detection, whether by suspect cases or mass screening and identification of patient. Here by identification, I hear data collection, identifying patient, and all schemas of methodology used in the research. They must know sometimes means of existing screening, their types. Here, I think to know what is used to detect the virus, like PCR, and other methodology like serology, which is used in detection of the virus. A student can also be involved in the choice of methodology.
Okay.
I think
the students can be involved in all four of the pillars. So I was just saying, like, you know, if you can think of one thing, right? Like one 30-second thing, 30 seconds, like just a little thing. Okay, David, can you do it? Can you do 30 seconds for me? Can you do it? Make it tight. I know they can be involved in anything, but I want you to make it tight. Give me like 30 seconds of an answer.
30 seconds of an answer. Students
Pretty
can contribute probably in about 2 things or 3. One is research. There's kind of research in the community. But 2, it's social media, educating people through social media. I think those are.
Okay, great. Makina?
So I remember it was
30
actually
seconds, Makina. 30 seconds.
No, don't worry, I will. So I was going to say it was actually I couldn't enter the hospital environment myself because I had family members who were immunocompromised, and in the beginning I was stressing how important it was to try and get involved in research. It's been a few weeks now, and I actually want to change my answer to more focusing on mental health and the mental health of your family and friends around you. We can't go into the hospital right now, but that doesn't mean you necessarily have to be doing medical things online. There's a lot more things you can do in the community that many people have forgotten. People are suffering because they can't go outside. They don't have the interface they're normally used to. So I think it's best to use our efforts towards that, and it's important at the same time.
Nermin, 30 seconds. What can we do if we can't go clinical?
Education. This is actually the motto of InciSioN Egypt: research, educate, advocate. And I think that's what we can do outside the clinical aspect.
Okay.
Okay.
Perfect. It's perfect. How about you, Ahmadreza?
Oh, I'm sorry, I was muted. Have you ever seen that I can summarize my speech in 30 seconds?
No, I know you can't, but you're going to.
Honestly, the most important and the most exciting part that I think students can be involved is public education, as the previous friends have said. And we cannot be involved in clinical process, but we are accepted by common people, by people, for being a reference for medical questions and medical challenges. So I believe the best part is being involved in public education. I see someone said that has lost my voice. Could you hear me? Or I was muted.
We can hear you.
Okay, that's it. That's it. I think I've used my 30 seconds.
Yes, you have, but that's okay. So I think I want to take a little bit of what Makina said, okay, and also a little bit of the discussion that we had about social accountability and community empowerment, okay? So the first thing that I think is really important, and I'm going to share my screen for a second. This is scary. I'm like sharing my screen on, live, which is really freaky. Okay, but we have and the importance of that is that you can always call people, right? And whether that is, your friends who are at the hospital or your consultants, right? It's really nice to check up on people and make sure that they're doing okay. Family members, and, others in the community as well. There's students who've been calling older patients and, people in the community and stuff like that. So that's really great. And education is amazing. So one thing I wanted to talk to you guys about the student empowerment of the community. Okay. So the people who are unable to afford masks. Okay, let's talk about that for a second. If we had the ability, in the sense that we have a group that can potentially teach someone how to sew masks, right? Do you think that empowering a community to make masks for themselves would be worthwhile? Do you think that that would work? Right? So, you know, it's very interesting how, again, when you're students, right, you're able to approach people and talk to them and tell them the importance and why, okay? And if you have community partners to go into a community and be accepted by that community, right? Being able to say, hey, this is why the masks are being used, okay? And we can show you how to make the masks, right? And we'll give you the cloth to make the masks with. I mean, Nermin was telling me about how they were able to garner funds enough so that they could buy ventilators, right? In your local InciSioN working groups, right? I have a question and I have a challenge to you, right? Do you think that those communities who are vulnerable, right? Could you imagine either having an educational campaign that, and Kathy has no idea I'm saying this, just so you know, she's like, oh God, what is she gonna say? Could you or would you imagine taking on an initiative such that you're doing an education, public outreach of why you need to wash your hands? And if you don't have the ability to wash your hand, let me show you how to make a substance, whether it's with bleach water or other, making the antiseptic stuff to clean your hands with. Yep. And then let me show you how to make masks that are cloth, right? Do you think that that is something that would be feasible?
I think that health education would be more important than the mask.
You think what?
People, if I understand your question clearly, I thought you were you're saying either do the health campaign or teach people to wear masks. Is that right, or did I understand you wrong?
No, I'm saying that as a part of would you guys want, Kathy, do you want to like say this, what I'm like trying to say, or maybe I'm just saying it incorrectly? As a part of each national working group's outreach program to these vulnerable communities, do you think you would take the challenge, I guess, of making an educational campaign for them, which would include, right, teaching them about hand washing or sanitation, and also teaching them how to make masks?
Do you think this would be feasible? Do you think it's something that would empower the community? Is it possible to do that, in your experience?
I think
if you had all of the tools, because remember someone else said you had to have the right faculty person to give you all of the tools. So let's say I gave you all of the tools to do that. Would you think that it would be feasible?
I think it would be possible, but we have to research the situation to see what population would be more receptive, and so what we do can actually have an impact, like pick our population or maybe pick the youth, because they're going to be able to transfer their information to other people. So I think it's kind of a pick your fight or something like that.
Anyone else?
I can try.
I think it's something that that can be done, because we've been doing similar things. Like with personally on my side, we have visited some secondary schools or places where people have been have been more unprivileged. So I believe making masks is something which is a lot more easier than making sanitary pads. But currently, as I see the status of our country, making of masks has been something which is already almost everywhere, so it's very easy to access, and that's therefore going to teach to make that. I don't think it will be very applicable to us because of their masks which are being made are readily available, so most people can also make at home. There are a lot of people that make do the sewing and cutting of clothes and make masks very easily. So on my aspect, and the side of my country, is something which we can do, but I don't think it will have much of an impact. But maybe washing hands is something which would be very meaningful and being done.
So I know Created for Crisis actually has an outreach program in Tanzania. So they're working there to empower the local communities to make, they've given patterns and provided like a bunch of stuff and everything. So yes, that's what I was just curious if the other countries are interested in that. Then I can poke Kathy a little bit more and Ahmadreza and Makina, because I'm like totally like, I love Makina. She doesn't know how much I love her, but I do. And I think that having these educational campaigns and reaching out to the communities is something that is powerful. And we have a couple of different things that we have up our sleeves that we can potentially empower everybody with on this call. What do you think, Pavranaj?
I think just as David said, okay, it has been done, but we can reinforce this this sort of education. Some people have masks, but they're not properly wearing them, and so we can, for our sake of like reducing, at least flattening the curve and reducing the rate, because we're not close to cure, at least stop the new infections. But we can try to target certain communities who do not believe in these things, try to educate them. And then if they're in like situations where there's no water to clean reusable masks, we can try to provide them with like disposable ones. But at the same time, we can even, there's that saying about teaching, giving people fish, and then there's the one for teaching them. It does help that way, but then again, you need to target certain populations who do not have that currently.
Okay, so if you guys are interested in doing that, we have we have the ability to facilitate, and as we move forward, we can absolutely empower that. So then the very last thing, I'll say, is that each one of you has these beautiful, beautiful expressions, right? And we only on these panels get to talk about one little aspect, right? And I want to know more, right? I want to know more in depth about each one of your stories, right? Your experiences during COVID, your experiences in life, right? And you may think that I'm not sincere about this, but I hope that my sincerity has come through a little bit, because I really, really do, okay? And the way that I want to immortalize what you guys have been through is we're going to put a book together, okay? And this book is going to have stories from all over the world. And eventually, if you want to be anonymous, right, you can say that. I mean, obviously for like the editing purposes, et cetera, you have to tell me who you are. But otherwise, I just want to hear your story. Right? I want to make sure that from every aspect and every country, that the words and the, you know, the experiences of the students, right, whether it's from getting kicked out or having to work in a situation that you don't want to work in, to begging to get back in, whatever it is, right, to not being able to because of family, right? I really want to hear your story. And so Kathy just put this in, is if you go to this website, okay, and it will show you, it shows you, and it will ask you about stories, and you can share your story here. And it's a pretty simple form, and you just upload your document, right? And that's it. Okay. If you say anonymous or you choose a pseudonym, that's fine. Again, for purposes of you know, editing, etc., we do need to have a way of contacting you. But otherwise, I will respect anything you say. So please just tell me your story. Any last thoughts from anyone?
Yes, do you need the story here right now?
Oh no, the stories are going to be posted on the website. The link, you can share it through the website. It's written format. It's going to be in a book.
Yeah,
Thank you.
It's going to be written in a book.
Yeah.
And this is open to everyone. You can share that and, you know, inform all of your friends to submit their stories on that form.
And it's not even limited to students. You can share it with anyone, any allied health, any community members, family members. Everyone's perspective is different. This pandemic, you know, everyone experiences it differently, and it's all very valuable.
And there's, you know, the page is evolving, but I talked about it at the very first session. We're also going to have a link there where you can upload a video, because sometimes people are uncomfortable writing, right? So you can just talk about it, okay? And we'll transcribe it. Or you can just audio, you know, say whatever it is, and we'll transcribe it, okay? This is really important to me, because I think that we oftentimes, honest to God, forget about, you know, the perspective of students. So I do hope, again, like I said, that you see the that I'm being sincere and not just saying that. There's a question. Okay.
No, there's no question, and I think we've discussed all questions in the Q&A box and in the chat room, and I'm glad that, you know, we've talked about many things, you know, more than what we were supposed to talk, and that was amazing. You know, that's the thing that makes these sessions, you know, amazing and beautiful and incredible.
Any last thoughts from anyone? I love hearing your last thoughts. Anything that you feel right now? Okay, now, if I say 5 words, this doesn't mean a lecture for like 5 minutes, guys. So any last few words? Makina, anything? Okay, David, you want to start? All right, cool. You can start.
Thank you. I'm very excited about this because I've realized that I've also been challenged that there's still plenty that we can do, and we can take direct action towards addressing policy issues. So I think there's still a lot that we can do, including the book idea thing. I think the stories thing is also great. I already have plenty here. Thank you.
Absolutely. I love it. And if you have artwork or anything, we will put it together.
So,
Nope. Oh, all right, John.
Yes, thank you very much. I don't have many things to say, but what I can say is that I'm grateful for this event because this shows me that we will have the same problem and that we must face it in collaboration. So this inspires me to get in touch and to ask to everyone here and to others who are not here, who are not listening us, because they will see this video after. And this is the reason that this may continue to happen. Thank you very much.
Pavan, Nermin?
I just have 5 words and I'm going to respect that. So we will overcome this together. And thank you so much for this very insightful session and for everything.
I'm very grateful and thankful for the invite and for being here. I want to end with kind of a quote for Mamta. COVID is showing us what we can do when pushed to the edge, and it has been really inspirational for me to be here. Thank you, Mamta. Thank you, everyone.
Mamta, you're muted.
Yeah. Any last words, Kathy?
Just that week after week, when we come to these sessions, I'm so inspired by each and every one of our national working group leaders, by our members of national working groups, and you know, thank you for being here. Thank you for everything that you're doing. And I agree with Pavranaj. We will beat this together.
Do you want the final word, or you want me to have the final word?
Okay, I just wanted to ask Makina. Makina, I'm sorry, just would you mind to mention our colleagues who were, in charge of this session in your team? I just forgot their name.
Sure. No worries, that's fine. I should probably introduce myself as well. So hi everyone, I'm Makina. I'm the webinars coordinator, and me and my wonderful team have been sort of the people behind these webinars so far. So for this webinar specifically, I'd like to give a special shout out to Queenie Hong and Lucas Pointe for helping putting this webinar together. Thank you.
Thank you very much. I just want to thank everyone, especially our dear faculty, Dr. Swaroop, Mamta. Thank you very much for being with us and for your great, discussion and support and comments and guidance. And I really appreciate our dear panelists who were really incredible. I was, I had been receiving messages on the behind the scene that they were saying that, wow, these guys are incredible and these thoughts are really, these are not the students' thoughts. These are, much more mature than a student. And thanks a million to our dear attendees for being with us. And I'm sorry for going over the time, and that's it. Really, I will see you on 2 weeks later.
You guys make me, I think, tear up more than any group that makes me tear up. You're inspiring to me, and you like make me push myself even further, and it's so wonderful to be with you. Thank you for allowing me the privilege, Makina, Kathy, John, David, Nermin, Pavranaj, for being here, for moderating the session. And just remember that you can do anything that you put your mind to. Don't ever let anyone say that you can't do something, because you can do it. Okay. Office. All right. Bye. Go. Signing off.